Look at this room. Hello, everyone. Thank you so much for hanging out and joining us after a wonderful plethora of information for the first day of TIP QC. My name is Tiana Pyles. I am your executive director for the Tennessee Breastfeeding Coalition. And welcome you all. So good to see your faces. Hello, Anna. I miss you. And we usually take our selfie at these events together, so that we're always posting on social media. I miss that, girl. And we will get back to it. But in the meantime, at least we have this magical world of Zoom. Okay, I'm going to date myself, but for those who have children, you remember the PBS thing? Come on, let's Zoom. Come on, let's Zoom. So I'm like, okay, I guess they were warning us for what was to come. So here we are. Come on, let's Zoom. So again, thank you so much for joining us. I'm going to share my screen. I'm just going to do an introduction before we get into some meat and potatoes. And we're not trying to keep you too long. So again, thank you so much for joining us. All right, so I'm going to share. And wait a minute, let me close out some things so all that stuff doesn't pop up. No, we don't need all that. Okay. All right. We want to do, see here. Okay. Okay, save. And you all tell me, okay, let me go into the proper mode. All right, can you all see my screen? Am I getting some nods? Wonderful. So again, welcome to our TIP QC Tennessee Breastfeeding Coalition meeting, our annual meeting at TIP QC. So I just wanted to say happy winter. How's y'all's winter been? Oh my goodness. We have had quite the weather in the last couple of weeks. So just wanted to say happy winter. Here is our wonderful logo. So again, welcome. This meeting serves as our first annual meeting. And we usually take advantage of this time together because we've already come together from across the state for TIFQC. And of course, the breastfeeding work group predates the coalition, but this is our fourth anniversary. So happy anniversary to us in this important work that we are doing. So I always like to do that. We continue to stay committed to our mission, which of course is to improve the health of all Tennesseans through education and support of breastfeeding as the cultural norm to help further empower families. You will also see our vision listed below, and it is on our Facebook page as well if you would like to look at that. And of course, at any time, if we need to update this information, of course, we can do that also. This is our social media presence. We have a Facebook page at this time that we're doing pretty good on. We need, of course, more input, more, of course, things that have been information that's vetted, especially now with everything else going on. So as you all find that, please, by all means, send that to me and we can get that on our page. It just keeps us current and posting in this world of social media. So just I always like to put that in there. We're not going to do updates yet. My apologies. I wanted to get to the agenda. So what we're going to do, I'm doing the introductions now. And so what I wanted to mention to you all before we move into having some time with Elizabeth Harvey is that we have been actively working on our committee work. I'm so glad to say we've been meeting monthly. And so we are working on our state directory of breastfeeding lactation professionals. And I would love for you all to join us in that and take this opportunity to not only do our sign-in sheet, but it's going to serve also as a way to get your information to be a part of this. This is just the beginning, but please look out for a beautiful stellar. It's going to be online. It would be interesting to see this in some type of other format also, but we figure we take advantage of these opportunities as we gather together to get you all's information into this database, if you will. So Shakur, if you would be kind enough to share our sign-in sheet virtually in the chat. And if all of you all would do that, please, that would be absolutely wonderful. Also, what we are working on is a part of our educate and engaged for our lactation professionals and some other opportunities for continuing credits. We know that we are so very busy and hard at work doing this work. And so sometimes, we come up to the time of relicensure or recertification. It's like, we don't have those hours. So we're trying to make sure that we're not trying to have that be too much of a burden by supporting as best we can. So that's another initiative in which we have been working on. So lots more to come soon. As you all have any ideas or thoughts of other things that we need to be working on as a part of our work groups, which are development and access to lactation support, engage and educate, healthcare provider education, and then of course our steering committee and social media, like I said, is just tied in through all of that. And so as you all come up with the wonderful ideas in which you do, please reach out. If there's something we need to update or add, we're definitely open and game, because that's of course how breastfeeding works. You think you're headed in one direction and we need something else. So we need to add something else. So please, we of course welcome you to do that. So what I would like to do now is to turn it over to Elizabeth Harvey, who is our CDC liaison, entrenched in maternal, child, and health, as well as a lot of other things. And I know how that goes, because you think you're gonna just be here, and it's like, no, you are needed in so much more. And so as she was saying all that she is, it's like, okay, I'm gonna put maternal child health and then and a lot of other things. And so, Elizabeth, I so thank you for joining us today to be able to give us some much needed updates on just this world. Breastfeeding was before COVID and it's going to be way after COVID, but there are some adjustments along the way that we need to just really know about. And of course, we don't want to be redundant. So we felt that we were trying to give you some authentic information for our group. And so once again, Elizabeth is going to be joining us. And yeah, you've already switched over, which is wonderful. And so I'm going to turn it over to you. And thank you so much for joining us.
Well, thank you so much, Tiana. And it's a privilege to be at the annual meeting, albeit virtually, and to see everyone. As Tiana mentioned, I'm a maternal and child health epidemiologist, and I'm one of our co-leads for our COVID-19 and pregnancy work group. And so in that, we do a lot of surveillance around breastfeeding. And on Thursday at TPQC, I'm going to present some information that's more specific to COVID-19 and pregnancy. But again, today I want to really talk specifically about COVID-19 and breastfeeding, as well as some updated information that we've learned regarding the vaccine just yesterday. So exciting stuff. So we'll go ahead and get started. And I'm also going to be joined by Dr. Carolina Clark and Dr. Morgan McDonald in the Q&A after this. So please feel free. As I present, it's kind of hard to manage the chat and everything. So feel free to put things into the chat. I'll have Carolina monitor that and help sort of address those questions at the end of the presentation. But if there seems like there isn't something that I've addressed, please feel free to speak up. So we will go ahead and get started. There we go. So in today's presentation, I want to address some of the current evidence and guidance we have specifically on COVID-19 and breastfeeding, and what are those implications for lactation support services. I'll then get into talking a little bit more about our Tennessee specific data and what we see regarding COVID-19 infection and pregnancy, and how that really is associated with breastfeeding initiation. I'll talk about some of the current vaccine safety evidence that we have for pregnant women, as well as the Tennessee vaccination plan for pregnant and lactating women. So to start off, I wanted to share some information from a systematic review that was completed in June of 2020. So as a reminder, a systematic review really summarizes a bunch of studies in the literature, and this analysis sought to estimate the risk of the neonate becoming infected with SARS-CoV-2 by mode of delivery, type of infant feeding, and mother-infant interaction. And it found that neonatal COVID-19 infection is uncommon, it's rarely symptomatic, and the rate of infection is no greater when the baby is born vaginally, breastfed, or remains with the mother. So just to reiterate, from what we know, neonatal infection is not greater among breastfed infants compared to non-breastfed infants. So again, the CDC has produced some really helpful infographics that we as the Department of Health are going to be rebranding with our Tennessee Department of Health logo and putting out via our website. And this has some helpful information on how to safely breastfeed if you have COVID-19. It reviews different scenarios based on a mother's breastfeeding choices. We have these available currently in English and Spanish and are working towards translation into Arabic, Kurdish, and Somali. So we're really trying to make these accessible to populations in need. And so if there are other translations that you need for your communities or your hospital groups, we can request those. And so please just let me know. So during the COVID-19 pandemic, it's critical to ensure that people who are breastfeeding or desire to breastfeed continue to have access to professional lactation support. But as we know in a pandemic, we have to be adaptable. And breastfeeding problems, as we know, and as I've personally experienced, are often urgent and require immediate assistance. So the CDC recommends using alternative approaches such as telemedicine. So how can we maximize that use? However, they also recognize that in-person support may be necessary and does address infection prevention and control measures. So more information around the use of PPE can be found on their website, and I can make sure to distribute these slides to you all. But again, it's really important to understand that in some cases that in-person support may be necessary, but there are ways to protect yourself with PPE. One of the tricky things regarding guidance around breastfeeding is that you're not just talking about one person, you're talking about a mother-infant dyad. And differences in exposure or suspected or confirmed COVID cases can be really tricky then in understanding what you do and how that could impact breastfeeding. One thing that I really like about the CDC website is it has these scenario examples that walk through in lay terms what you need to do, isolation and quarantine guidance, and other precautions that you need to take based on the specific situation. So highlighted on this side are some specific scenarios. So maybe the breastfeeding person has suspected or confirmed COVID, but the breastfed child does not. Or maybe that's vice versa. What do you do? And so it's really helpful just to have these specific scenarios lined out, and so that you have proper guidance, because it's not necessarily intuitive, and there are many different factors at play when you're dealing with a mother-infant dyad. I'm not going to transfer more over to what we're doing in Tennessee. So as I mentioned earlier, I co-lead our COVID-19 and pregnancy surveillance work group, and we initiated that project back in April of 2020. And we're conducting surveillance to better understand the epidemiology of COVID-19 among pregnant women and infants and inform clinical guidance in obstetric and infant settings. So clinical guidance also includes information around breastfeeding. So we're collecting data on a lot of indicators, but I'll focus these next few slides on what we're seeing specifically in breastfeeding data in COVID-19. So when we look at all of our data of live-born infants born to women infected with COVID in pregnancy, 79% of infants were breastfed. And that compares to our 2019 statewide rate of 84%, so a little bit lower. So one of our questions of interest was, for those women infected in pregnancy, does it matter, that timing of infection, does that matter for initiating breastfeeding? And what we do see is that timing of infection does matter. We observe a trend of decreases in the percentage of infants being breastfed or fed express milk the later in pregnancy the mother is diagnosed with COVID-19. So if we look at our first bar here, 85% of infants born to women infected in their first trimester of pregnancy breastfed, compared with 72% of infants with mothers who have their first positive test at delivery hospitalization. So timing matters. And again, it's important to have this additional context. We also examined how breastfeeding among live-born infants born to moms with COVID-19 infection and pregnancy varies by race and ethnicity. And again, I think we continue to attune ourselves to the importance issues, not just, we know the disparities in COVID-19 cases overall, and it's important to keep a lens of health equity in all of the work that we do, including how this impacts breastfeeding. So similar to what we see in statewide data, or in our population data, that non-Hispanic Black infants born to moms infected with COVID-19 have the lowest breastfeeding initiation. And so, I mean, this is the data nerd in me. So take a step back, don't be surprised at all this, but I try to also think about how can we piece these two components together. So we also wanted to stratify trimester of infection by race to inform more data to action. Like, does this differ? Do we need to be thinking about different interventions differently by race, ethnicity? And when we do, we see that trimester of infection and breastfeeding at discharge were significantly related among non-Hispanic white infants. So among non-Hispanic white infants, 92% were breastfed among moms infected with COVID-19 in the first trimester, compared to 80% in the third trimester. But, you know, taking away statistical significance for a second, I think it's important to also just see the trends really do exist for Hispanic women and also like Black women as well, that you do see this decrease, especially concerning what's happening at that delivery hospitalization. Obviously, we've been through many different phases of this pandemic. So we've also wanted to examine breastfeeding by birth month and month of the mother's first positive test. So the percentage of women breastfeeding by both month of delivery and month of first positive test demonstrates sort of these similar trends, with sharp decreases from March through May, and then a steady increase for the remainder of the year. So again, how does what we were going through in those early stages of the pandemic sort of appear in our data, right? And so in these early stages, we see a really big drop off, but then as the pandemic has continued, that we do see sort of a bounce back of breastfeeding initiation overall among women who have been infected in pregnancy. And I think, you know, as the pandemic continues, we continue to receive more research, more evidence around what's going on, and that could be reflected here. So now I wanted to move a little bit into vaccination. So I think an important thing to note is that there are neither data on safety of the COVID-19 vaccines in lactating women, nor in the effects of the mRNA vaccines on the breastfed infant or on milk production or excretion. We don't think that mRNA vaccines are a risk to the breastfeeding infant, but you know, we are still learning more and compiling that research. So people who are breastfeeding and are part of a group recommended to receive a vaccine, such as healthcare personnel. So if you fall into another phase, you may choose to be vaccinated. I also wanted to share sort of, before getting into additional data, the ACIP COVID-19 safety update. And this is specifically, this won't address specifically breastfeeding data, but it does address sort of pregnant women overall, and I think is really informative. And this just happened yesterday. So obviously, as we know, pregnant women were not included in phase 3 of vaccine trials. And so this is an update on what we know to date of how the vaccine rollout has gone in pregnant women. So, and this is summary data as of February 16th. So a total of a little over 30,000 pregnancies have been reported to VSafe, and that is the vaccine safety monitoring system. And so you can see equal distributions, pretty equal among Pfizer and Moderna. And so, again, like pregnant women are obtaining this vaccine. And so there's also been established a pregnancy registry that's specific to VSafe. So VSafe participants who report pregnancy following COVID-19 vaccination are actively contacted to enroll in a pregnancy registry. And so these participants will be contacted during their trimesters after delivery and postpartum, and will include information regarding specific outcomes of interest. And they're listed here, but include miscarriage and stillbirth, pregnancy complications, and sort of other other adverse events at the birth hospitalization. So among those women who received vaccines and indicated that they were pregnant, a little over 1,800 have been enrolled in the VSafe pregnancy registry. And in that enrolled population, we've seen 275 completed pregnancies, including 232 live births. And so I think it's always important when you are presenting outcomes in a pregnancy registry, you also think about, well, how does that compare to what we would typically expect to see in the population? That can provide us with additional context of, when is that signal something that we should pay closer attention to? And so this lists some of the pregnancy outcomes, complications, and neonatal outcomes that have been seen in that pregnancy registry. And also in that left-hand column, you can see how that compares overall to what we typically see in the population. So for example, we see miscarriages are being reported 15% in our VSafe pregnancy registry, but overall we typically expect to see 26%. And so the interesting thing here is to look at we can think about adverse events falling into sort of pregnancy and neonatal specific conditions, as well as non-pregnancy specific events. And so 73% of adverse events were for non-pregnancy specific adverse events in this cohort. So that includes headache, fatigue, some of those adverse events, compared to 27% of adverse events were for pregnancy and neonatal specific conditions. So I really liked the summary slide, so how do we digest this information? What do we take away? And I think, again, the important thing that I would take away is that the reactogenicity profile and adverse events observed among pregnant women in VSafe did not indicate any safety problem. And that while miscarriage was the most frequently reported pregnancy-specific adverse event to the registry, that these numbers are within the known background rates based on presumed COVID-19 vaccine doses administered to pregnant women. So again, there have been no signals to indicate safety concerns for the vaccine among pregnant women in what we've seen sort of in this initial rollout of the vaccine. So I now will sort of review some of our state-specific vaccination plan. And as mentioned a couple times today, the Tennessee vaccination plan was updated a few weeks ago. And one of the key updates was that pregnant women are now included in phase 1C, which will open on Monday. So this is really great timing, especially for our advocates in the field and for public messaging. So women who are pregnant will be eligible in phase 1C to receive a COVID-19 vaccine. Again, they are at higher risk of adverse events compared to non-pregnant women. And that's something that I will discuss more on Thursday. So more to come if you're interested in learning more. And these are some slides about sort of what the vaccine distribution looks like so far, just from a bird's eye view, is that in the state, 1.7 doses have been delivered and over 1.7 million doses have been delivered and more than 1.4 million doses have been administered. So I like the statistic of that 1 in 7 Tennesseans with at least one dose. And that we have about 500,000 residents who are fully immunized. And just some helpful resources to follow along if you haven't already explored some Tennessee Department of Health and just state level resources. You can follow the progress of vaccination through this website listed here. And what you can also see is not only the total vaccines being reported, but sort of the number of doses administered in the previous week, and a breakdown by that of sort of who's doing that administering. And I think really important, again, as we have talked a lot about today at TIFQC from a health equity perspective and a racial justice perspective, is to really understand how distribution of the vaccine, how equitable is it, and are we reaching populations that we need to be reaching? So again, it's important to collect and actively be transparent in that information and identify places where we need to do better. This is information specific to sort of a county vaccination availability, a way to look at availability and to request an appointment with the health department. And again, just some more general information here regarding COVID-19 vaccination registration. And what's exciting is that now, actually think that this slide needs to be updated, because now the Johnson & Johnson vaccine also received EUA, although I don't have the specifics about if that will be through. I don't think that will actually be through the county health department, so that might be why. Okay, and so here are some FAQs of sort of where you can get vaccines. So all 95 health departments have vaccines, some hospitals, nearly all Walmart pharmacies, Kroger pharmacies and local pharmacies, FQHCs, and it's coming soon to some Food City pharmacies and other national chains. So again, continue to elevate and publicize information regarding the vaccine and how to get an appointment. And then in the meantime, a vaccine is one part of our strategy of getting back to normal. And so we still need to wear masks, maintain distance and avoid crowds, and wash our hands often. So we will get there. It's crazy to think that it's been a year, and to reflect on that brings up a lot of emotions, I would assume, for all of us. But I think there's also a very hopeful message in that, and specifically for pregnant women in Tennessee, I'm hopeful. So I will leave you with a picture of my two little munchkins who are enjoying the snow. Thankfully, they have grandparents from Buffalo, New York, who equipped them with snow gear. Otherwise, they would have been outside in rain jackets. So I'll end with that. And thank you so much, Tiana and Laura, for having me be able to present to you all today and to be a part of this TIFQC community. And I'm happy to open it up for questions and invite Carolina and Dr. McDonald to join as well.
Great. Thank you so very much, Lizzie. That was wonderful. So good to get an update. Shakura, are you keeping an eye on the chat? I haven't seen that many questions come in.
Carolina, there was one comment from Tracy. It's my hospital furloughed the lactation staff at the beginning. At the beginning of the pandemic. We were called back in July. If this happened in many places, that could explain the numbers. It's interesting to hear about that experience.
That's really helpful context, Tracy, to think about that. And I think that also shows the essential work too of lactation consultants in many ways. So that is helpful, especially, so we transmit these data to the CDC on a monthly basis. And there's actually, we are working on a multi-jurisdiction paper specifically looking at breastfeeding. And that is really helpful to think about, and something that hasn't arose in our discussions at the state level about staff furloughing specifically for lactation staff. So that's definitely something that I will bring back to our group as we continue to sort of discuss our findings.
And along those lines, there's a follow-up question. What resources or ideas / data is available to advocate for more lactation consultant staff at hospitals?
I mean, Laura, I'll turn that over to you. I think being able to talk about these data, to have, to get to present information regarding what we know. To me, the main take that I have from our Tennessee data is, and we do see this nationally, is, this decrease in women who test positive. We also are doing a lot more testing at delivery. So we're going to catch more women who are positive at delivery, right? So it's, we aren't testing equally by trimester, but I think when we do get that information out, and that evidence out that we don't see differences in neonatal infection based on breastfeeding, that we can continue to advocate that women have these resources and how to talk with women and empower them with knowledge regarding what we know and also what we don't know about COVID-19. So I think, that's something that we can continue to provide data at the state level. We are over 2,500 cases in pregnancy. So we have data, and we can potentially also look at this if it would be helpful by breaking it down for your sort of local region. We do regional analysis, so if that's something that would be helpful, any data that we can provide on the state and that can empower you from an advocacy perspective, please let us know.
Yeah, Lizzie, just to kind of build on that. Hey, this is Morgan. Just to build on that, yes, it certainly saw a lot of furloughed staff and really across the board in hospitals, a lot of radiology, a lot of nutrition staff, a lot of, and that had a huge impact on healthcare delivery as a whole. And certainly I think the MCH population in particular felt that. We've offered a lot of support to hospitals in navigating that and bringing staff back, and some staffing, over $50 million in staffing assistance grants to hospitals. And so what we're hearing from hospitals is that for all furloughed staff has been brought back, and services have been aren't back to normal, because still about 15% of our hospitalizations is COVID positive, but are closer to normal compared to the 50% of hospital beds that were taken up in December and in January from COVID. And then, generally in thinking about data for promotion, particularly of lactation consultants, we have broken down by county the availability of CLCs and to an extent IBCLCs by county. And so we can revisit that. Typically we do that, in the summer, but if that's helpful from a local.
We lost you, Morgan.
Yeah, I think she was saying that we also have information regarding CLCs and IBCLCs at the local level, so we can have data that we can also help with that if that would be useful.
Right, and that is going to kind of go hand in glove with what we're trying to put together with the coalition in creating a resource list that's statewide, and that will include the CLCs and IBCLCs. And in the chat, you've got a couple of places to put your information in. At the very beginning of the chat box, I put in the REDCap survey that the state has been collecting for the last couple of years about just breastfeeding friendly folks, whether you're actually a lactation professional, or you have a business that promotes breastfeeding, all that kind of thing, or if you're a provider that is particularly interested in breastfeeding, you can complete that REDCap survey for us, and that will also be included in the survey that the coalition is getting together. And I believe Shakura put that as far as like the sign-in sheet. We'll also kind of use that to begin building our resources information too.
I'd just like to add that concerning COVID, that I've taken care of moms working in the breastfeeding clinic, outpatient clinic, who have shared that they don't get much help in the hospital, and because of COVID, they're being discharged sooner, so they're not getting very limited help.
Yes. And I see Janae has also put up a link for staffing recommendations in the chat.
Great. Well, thank you so much. Again, my email is listed here, and I'm happy to be available if there are any additional questions, or most likely I might not know the answer, but I will get back to you and connect you with someone who can. So thank you so much, Laura. Thank you, Tiana.
Thank you, Lizzie, very much.
Thank you, Lizzie. You know, it's interesting what Helen brought up about just that support needed for for families being discharged at the hospital on top of all the other just usual, you know, new mommyhood things. Are there some resources for helping those who are infected with COVID-19 being discharged? Maybe I guess that's another thing we got to work on, which then of course means we're also checking on them as we should be for everything else going on with our new moms. But you know, like I said, there's always something else.
No, we
Tiana?
have a system that we follow
Yes.
them for the first 30 days.
Okay.
So, but and we continue telehealth or telemedicine lactation consults, but those just aren't quite, you know, there's only so much you can do with those. So, but we continue those. But I think outpatient offerings have really taken a huge hit.
Okay. All right.
Tiana, this is
Hello,
Tiana,
Melanie.
this is Melanie. Hi, how are you? I just wanted to talk a little bit about the Tennessee Breastfeeding Hotline. We definitely, I just will say this, emotionally, I had a lot of the providers that answer calls on the Tennessee Breastfeeding Hotline say there was a lot of people crying. We had this tremendous amount of emotional anxiety around having a child, and then just people kind of pouring out to our lactation consultants about how the hospital felt so sterile, they couldn't see the nurses, and they were discharged early. And so we saw definitely, and I may have been in touch with Laura about this, a huge influx of even a more emotional turmoil on the Tennessee Breastfeeding Hotline during these peaks, especially when it first started. So, you know, we're grateful to run that line and be able to help people best we can, along with everything that you're doing in the state as well.
Yeah, that is a blessing. Thank you for letting us know of that. How have you been offering, like, I don't know, additional training just on emotional support, or is it kind of just still kind of in line with you know, like, well, I know we're counselors, you know, at heart. Has there been a need for further education?
Well, I certainly, I just want to emphasize this to everybody. I mean, we certainly stay in our scope of care, but as we all know, working in the lactation field, you know, people tell us things, right? They will say things to us. And if there was a referral, I think I may have even referred to Laura. We've had maybe a couple of cases where I had to reach out to you. Yeah, because it was out of our scope of care, and we needed more support. And so, you know, we know our boundaries. I think it's a great question, but I just, I want to say that I think it was Tennessee that called with a mom and a father who both reported having postpartum depression. I think that was us, and that was tragic. And I know it probably happens more often than we all realize, but to have that in the middle of COVID, and they both said, we are in a place of devastation right now, was really upsetting. We're glad we could be there, but it was really tough. So.
Okay. Thank you for sharing that with us. We just have to get better electronic program, and you know, at least let them know we're trying our best at this time to reach out. But that's good that they're using the hotline as well as some telemedicine. And I know that sometimes I think some of us are in this work because we love families and these babies, and you know, the interaction that we usually get with them. So my goodness, so we just all have to just figure out in the best of love how to still be able to reach through the screen to our families. I know I've been texting up a whole bunch to my moms, just checking in, you know, and it's exhausting. I know y'all are exhausted. But it's like, you know, they needed us before this, and now they need us like even more. Right. So, but I hope you all are documenting your type of care that you're giving, because although they are you and you're being your authentic self, we also need to learn from each other how we can save ourselves and also care for others. And I think Shakur will be happy to hear me say that. Because sometimes she's like, girl, when are you going to take a moment to yourself? I said, no, but they need us. They need us. So we just have to figure out how to be there for each other as we are caring for our families. But thank you for that. Thank you so much again, Elizabeth. That was wonderful. And like I put in the chat, hot off the press. So see, here we are, Tennessee Breastfeeding Coalition, hot off the press. Yes.
Thank you so much. And Melanie, I might just also follow up with you regarding that data too. Like if we can document that rise, we're also trying to document information on our PRAM survey, which surveys mom like 2 to 6 months postpartum regarding when we have specific COVID-19 supplements. And we are looking at some information around the impacts of the pandemic on babies' healthcare and family. And so, you know, like we hope to gain some more, it'll be still quantitative information, but I think this qualitative information is really helpful to contextualize and understand what we're seeing, and also think about how to move forward and continue to state the importance of these support personnel. So thank you.
Yeah, I'd love to connect with you on that.
Okay, great.
Yeah, I'd just like to add, we do have telehealth available, and I thought we'd see more telehealth in the outpatient pediatric clinic, but actually they've all wanted to come in and be seen. And as you said, Melanie, there are a lot who are emotional and need just to talk to somebody, you know. So with the COVID, it's people are isolated, so it really does help to have somebody to talk to. And we do have a good resource here, which is virtual, so it could be used for the hotline, and that's Rattled, Baptist Women's Hospital offers the service, and it's on their Facebook page, and it's a support group.
Thank you, Helen.
And you do support as well with V-Stars, just being there to talk to them. Yeah.
Yes. Okay. But thank you for that. Any other questions or comments before we move forward? And we're doing great on our time, I promised, as promised. But we still want to make sure that we are informed. And I mean, that was just great conversation there in terms of making sure that we're gathering data on that rise. So thank you, Lizzie, for mentioning that. Okay, all right. Well, please, let's next turn over to our dear Laura Hutton, our chair of the Tennessee Breastfeeding Coalition, and also breastfeeding coordinator for the state of Tennessee. She's going to share with us some updates from the state about the
all right, we're going to go
program.
Much lighter than COVID now, but still within what we're needing to do. So I want to just go ahead and review everyone on women, infants, and children. That's also known as WIC. And the WIC basics are that we serve women, infants, and children. We provide nutrition education, breastfeeding education, and supplemental healthy foods. So our participants can be pregnant. You can be on the program up to 6 months postpartum, and up to 1 year if you're breastfeeding, and there's various levels of that. But you get breastfeeding support no matter if you're just breastfeeding once a day. You get breastfeeding support for the first year. And then our infants are on the program, and then children up to 5 years of age. So that's kind of the folks that we have. So what happened whenever COVID hit? We definitely right away shifted over to telephone contacts because our health departments did, distance ourselves and quit taking in-person appointments and everything to keep everyone as safe as possible. So for the over the telephone, then we could do our certifications, which is what you do whenever you put someone on the program. You have certain things that they have to meet, whether it's the income or having a nutritional risk or, some kind of medical problem that would make them have more nutritional risk, all kinds of things. So that's what's kind of taken care of at the certification. We started doing those over the phone. any nutrition education. We started doing that over the phone. And then we also started promoting even more our ability to do like online education through wichealth.org, and also just doing over the telephone, chatting with them about what nutrition goals or issues that they're having. And peer counselor support has always been over the phone, but they just had to kind of redouble their efforts in texting and telephone contact because they didn't have the straight line through a clinic. You know, in a clinic, you would go to one person and then you'd be handed over to the nutrition person and or to the peer counselor, and then you'd be, you know, it kind of had a flow to it. But with a telephone, everything was a little bit more disjointed, and sometimes it was difficult to keep a person on the phone to do these things because it takes a long time. Or, you know, peer counselors would have to call them back, and sometimes it would take several calls to get in contact with them. So we did see definitely not a drop in attempts, but I think we probably saw a little bit of a drop in actually being able to connect with people, with our peer counselors. And then also by the telephone, any other lactation support that came to the notice of our designated breastfeeding experts or other people in the health department that work with lactation. So luckily, amidst all this, we did get national waivers. And one of the big things in WIC is we always had to meet in person. Okay, that's where we kind of get that contact to see how things are going, to check on things that we might need to refer for. That's one of the other big things about WIC is we try to like find out what the whole family is going through and then refer, whether it's immunizations or rent help or some kind of in-home help. Anything that's going on, we try to refer and make sure that they get those resources that they need. So in-person has always been a really big part of WIC. So we got those waived so that we could continue to do telephone contacts and assessments. Then there were just a few other like document proofs that we got waivers on so that we didn't have to do quite as much emailing and texting of documents and that kind of thing. Many of our facilities did do a wonderful job of just converting everything to electronic and really didn't miss a beat as far as a lot of the requirements that are within this program. And then we also expanded our food items. Remember at the beginning of this, there was actually a lot of shortages, and it really impacted our WIC participants. And so luckily we were able to expand the food items that we could offer. Like a good example is milk was really short supply. We are a nutrition program, so for most of our participants, low-fat milk is what they are eligible to purchase through our benefit system. So no low-fat milk. So in order to keep them at least some nutrition, then we opened it up so that they could take more types of milk, and we wouldn't hit that. You know, eggs and bread, all of that kind of basic stuff at the beginning was really important for us to try to adapt to. We did put out social media for, you know, getting everything done over the phone. Our health departments were still pretty good as far as taking calls and getting appointments done and things like that. We did miss a little bit of a beat at the beginning, just while we figured out how this was going to work in this new world. And now our clinics are very busy with COVID work. A lot of the folks that normally work in WIC are now working COVID a good portion of their time. And so we continue to have to adapt to how we're doing things or who's doing what. And so we're looking forward to getting a little bit of relief as we get all of these immunizations rolled out. The field has just been phenomenal in what they've thought through to try to get things going, and then the amount of work and the commitment that they've had to our participants. just wonderful, and I can't say enough about them. So also during social distancing, of course, we increased the text and email. Social media contact was increased, and we started seeing then like the peer counselors or some of the nutrition education classes where they were able to move those to a meeting platform and keep their support groups going and things like that. Again, sometimes it took a minute, but we got that back up and running, and we're very pleased with that. The World Breastfeeding Week, month, everything, the big latch, and our baby showers, our folks just couldn't give up, and they shouldn't give up the celebrating of all of what we're trying to do in breastfeeding. And so there were drive-through celebrations, there was drive-in and park latch-ons, there were just all kinds of creative ways that we celebrated the month and other months since. The baby showers don't always happen in August, so those have been kind of sprinkled around. And our walk in Memphis was revamped to be a virtual thing, and we've just we've adapted, and some of it's been pretty fun. And the biggest kind of issues we had, especially at the beginning and still now, is just adapting to the work at home. Many of the health departments, they did like staggered scheduling, like half of the folks would come in 3 days and then 2 days and then switch, just to decrease the number of people that were in the office and keep the social distancing. We've done some work making sure that folks have the materials or the equipment that they need to work from home. So that's been going on, working really hard to do that. And luckily in WIC, our system that we now have, it's called 10WIC. It is a web-based program. So that meant that we could be at home and still do all of the certifications that we wanted to do. And it was just a matter of making sure that folks had access to the equipment that they needed, and the bandwidth that they needed to go ahead and do that work from home or from the office, but just doing everything virtually. So there's been a lot of adaptation, and we've made it, and it's really going well. So when we look at participation, participation in WIC is, you get on the program and then you receive a food benefit. And then if you redeem that food benefit, that's what we count. We don't count how many people are actually put on the program, but how many people are actually participating, taking advantage of the food benefit. And so that's how our numbers are measured. In July was our lowest, and if I'm remembering right, I think in previous years it's usually like the May, June is low. July hits, and you've got the kids out of school, and so you get kind of an increase. And then our highest numbers were in October this year, which I think is fairly typical. We usually have an increase in breastfeeding during that, right after August. We see a little bit of an increase in breastfeeding around that time. It's kind of interesting. And then our average participation was still, over 100,000, pretty much not really any different than before COVID. And I think we were actually kind of hoping for an increase, a bigger increase, and some of our clinics have. But overall for the state, we've stayed, kind of stable up and down, but it's a stable number. We haven't lost during COVID. So I just want to remind everyone, WIC does have income guidelines. They're quite liberal, all right? And really, in fact, a lot of participants could be teachers, sometimes even like first responders. actually their pay scale will put them in line to receive these benefits. So as you know, as you have folks come into your care, just remember that pretty much you can refer everybody to WIC, and that way we can capture those folks that don't feel like they're in need and may not have a high need, but we're a nutrition education program, and we're also kind of a stopgap thing. So we're there to help in that prevention side that we've been talking about earlier today. We can make that impact. It's shown to decrease obesity in grade school folks if they've been on WIC. We have a recorded increase in breastfeeding if you're on WIC. So we are that initial prevention program. So in addition to the income guidelines, if a family already has SNAP or TANF, or if mom, child, baby, whomever is on TennCare, they automatically qualify. We don't have to check their income or know about their income. So there's lots of options there. So in Family Health and Wellness in the Tennessee Health Department, breastfeeding is a priority, and Dr. Warren talked a little bit about the MCH block grant earlier today and the place of breastfeeding in that priority. So our goal, because it's measurable, is to increase breastfeeding initiation and duration. So we wanted to really look at through the equity lens and through the mental health lens to address the social, community, environmental factors that impact our residents in breastfeeding. So our focus we identified as being our communities of color and our rural areas who have lost hospitals, have difficulty finding caregiver, primary care providers, and we wanted to target those areas that are shown to have the lowest breastfeeding rates. So since this is TIP-QC and we're talking about hospitals, let's just briefly kind of review what we've got in Tennessee. In 2019, the number of hospitals that had more than 100 births was 58. So Tennessee had around 80,000 births in 2019, and 98% of those are born in a hospital. So that, the hospitals are our key provider by far there. And so then of the total hospital births, 15% were in a baby-friendly designated hospital. Now, as far as 2001, we lost a couple of hospitals in 2019, so I can't really say where the numbers came from for sure, 100%. But in 2021, we have the 4 listed here. We have St. Thomas Midtown, Jackson Madison, Maury Regional, and St. Francis Bartlett. And those are our baby-friendly hospitals, and I believe the best hospitals were shared earlier today. And there is a breastfeeding component to that. And I'm very excited to see that, that many hospitals getting on that. So that's kind of the number of hospitals that we want to try to impact and change, get the policies in there, get the education in there, get the lactation professionals in there to support that. So one of our strategies is hospital lactation support, and that's what I want to speak to. We wanted to partner with our birthing hospitals to increase lactation support.
Laura, one moment. We're getting a little bit of feedback. Just if
I think I got it.
Put your okay. Thank you.
Okay, so we're wanting to partner with our birthing hospitals, and that's a lot of you out there. And we want to focus on increasing lactation support and, just the provision of breast milk in any way in our communities with the lowest breastfeeding rates. And we identify activities in all of our MCH block grant things. So one of them is to reestablish a connection with our birthing hospitals. I know some of you may remember Jackie and her contact with all of our birthing hospitals and promoting the Tennessee Breastfeeding Hotline and all of that. And we kind of lost our helper, and we're trying to get back into the rhythm, or a different rhythm, of communicating with our birthing hospitals and promoting the breastfeeding hotline. The data that we have that is collected by our provider, continues to show that hospital referrals are the ones that call the hotline. WIC gives out they give out the breastfeeding magnet and all of that information. It's plastered all over our education material, but our WIC participants, they want to talk to somebody in person, and so they're on the phone with our peer counselors or with our nutritionists, asking their questions and getting their support. But otherwise, all of the referrals, nobody remembers that they got the information at WIC, but the referrals come from the hospital. And so the hospitals are really key to keeping that going and utilizing it as big of a resource as we can. It is, being used pretty much as our stopgap between hospital discharge and getting involved in more detail with the community services. So they're a really important bridge to provide services here in Tennessee. We also are wanting to increase our MOUs with hospitals to provide our peer counselor support. We have a couple of really good MOUs in Tennessee, and those have worked out beautifully. Our peer counselors provide the breastfeeding counseling in the hospital and get our participants or applicants sometimes on the appointment book to get their benefits and everything taken care of. So it is a really important focus for us. And so we also wanted to work with, or are wanting to work, will be working with our in the NICU settings for increasing the use of human milk. And I saw the wonderful work that Hendersonville did on their well baby unit, and that's very encouraging. And I think we can continue to push those numbers and find out even better ways to develop the education and the policies within both of these settings to just increase that human milk use. We also want to kind of continue to check in on all of our birthing hospitals. We've got the baby friendly ones, but previous looks at our birthing hospitals have shown that really a lot of them are meeting some of the requirements for baby friendly. So we want to continue taking a look at that, and possibly getting in some programs where we can start addressing the ones that might have the most impact, or at least trying to support those hospitals that are in those highest need areas to go ahead and push their infant care practices to an even higher level to help their breastfeeding. So we're looking forward to that. I put my contact information here. If you're interested in magnets or cards for the hotline, you can contact me. I gave Brenda a PDF of an order sheet, and you can complete that and mail it back in. and we'll get you any kind of the swag that you need there. And then Renee Love is also our peer counselor program manager. We partner to do most everything. So her contact information is there as well. One of the other strategies that we looked at that I wanted to cover today is the workplace lactation support. It's Breastfeeding Welcomed Here. You guys might have seen some of that. We wanted to take those businesses and kind of see what kind of support they had for their employees, because that's really the big thing. And to that end, and we also wanted to be able to look and see if we were looking at small businesses or minority owned businesses. And so we did add a couple of questions in the pledge that kind of get to that, so that we can then go back and look at these businesses and talk with them about what they're doing with their employees. And look forward to working with that. And that's just the link to the, oops, I didn't mean to do that. That's just the link to the Breastfeeding Welcomed Here. So anyone can go online and sign up their business to be Breastfeeding Welcomed Here, and they'll get a sticker and some information and be put on the website as a breastfeeding friendly spot to go if you're looking for that. And I also wanted to touch base with the Tennessee Pregnant Workers Fairness Act that was passed or put into place in October 1 of last year. And that addresses the folks that are pregnant or recovering from childbirth, and they want to express breast milk at home. They can't be discriminated against. And it gives the explicit right to reasonable pregnancy accommodations at work. We didn't previously have the pregnancy accommodations, and that has had repercussions to people across the state. So we've got that in, and A Better Balance has a really nice write-up of the law and what you can expect, and just get everybody informed about this, because it is new, and if we don't advertise it, no one will. So be sure and take that information and post it wherever you want to, and let's make sure that all of our pregnant women know that they do have rights to protect their babies in their work environment, and keep that going. All right, and then I just wanted to pop this up. If you go to tennessee.gov and our breastfeeding page, you'll see options for different folks. So if there's something you're curious about in breastfeeding, you can go to this spot and then click around and find what you're looking for. And if you can't, then you email me and I'll try to find it for you. And I just want to say thank you. Does anybody have any questions with what we're doing in WIC or what we're doing with breastfeeding in Family Health and Wellness? Thank you, Shakura. Wake up.
I had a question for you, Laura. What are you recommending for the breastfeeding moms as far as the COVID vaccine goes? I know this it's all new, but just wondered if you were what your
in WIC, we look and see what's on the CDC website, or what our health department is saying, and that's what we do. So that's kind of where we are. Do you want to speak to that?
I'll just add to that,
Lizzie?
Laura. This is Lizzie, that we are for communication with messaging, we are working with WIC to promote messages surrounding information from vaccines that is based in the evidence for pregnant and breastfeeding women. So that we view that partnership as essential, especially to get information out to people and from trusted providers that they have. So we will continue to, we're excited to do that, and especially to think about potentials with the market, with the new WIC app, the new shopper app. There are opportunities even within that new app that can promote different messages. So we are, I mean, the rollout is a little quicker than we expected, which is great news, but I don't know if we'll have it ready by Monday. We're trying. So, you know, it's a good problem to have, right? So more to come, but I think as we think about distributing our messages, we have been very closely working with our health disparities task force at the Department of Health to really inform about to address misinformation among pregnant women in vaccination. And I think to think about what are our other partners and collaborators that can help amplify the messages that we are trying to get out. And I think about the safety of the vaccine for pregnant women is essential.
Yeah. Can I add the ACOG and the Society for Maternal Fetal Medicine both have really nice statements that I think are really helpful. And our OB group has done a blog posting that I think is nice and reassuring. But just having that connection to an OB provider, I think is helpful. And Laura, can I just say, WIC during the pandemic, amazing. I mean, they were on it. Christy had already converted over and she had a plan. And I mean, we've just been so impressed and so thankful. It was a really great job.
Yeah, we are very proud of our folks in WIC. Very, very proud.
Laura, has the telehealth for WIC improved people's like showing up rate and more people joining?
That's a good question, Tiana. Some of the things that we've gotten from the field is many times it's just, well, you're a peer counselor, you know, you call folks and they don't answer the phone. You leave a message and maybe they call back, maybe not, you know. That has been, I think, our biggest barrier is just being able to get folks to convert to, oh, I need to call. This is just like going in. I have to take this call and I have to sit here and answer all this information and talk to them. And so that's been, I think, the biggest barrier. That's what we've heard. But with our new electronic system, we have several reporting options that we've been utilizing to get that participation rate up. And, you know, if we have people that are already enrolled, you know, they're within their certification, they're just not spending their money or their benefits, and or they've run out of benefits and don't know how to get them loaded on. Initially, we did have to do quite a bit of communication promotion to make sure people knew that WIC was still in business. We're, you know, call us on the phone. We can just keep going on. We're ready to keep rolling, you know. And folks just didn't realize that they could call their clinic and continue their benefits. So that there was a little bit of education up front, getting people to answer the phone, and that's the biggest thing. And just, you know, it took us a minute, you know, like I said, from switching from clinic flow, which we had all figured out, and trying to figure out how to do it on the phone. It was challenging. Yeah.
Thank you. Well, yeah, like you said, this is a learning curve for everyone. So hopefully that will help. And then there's more data to collect on behalf of WIC. Thank you, Laura. I'm going to fly through this, and just to say, please hang out. I would love to do a screenshot picture of all of us at the end, so you know, adjust yourselves as needed. But if I may share my screen, I have 3 updates to share, and then we will call it an evening, at least off of in front of our computer screens.
Thanks.
All right, share. Go here. Yep. And I don't know what it's going to pull up first. And let's put us in this mode. Okay, I gotta fast forward, bear with me. Okay. Okay, we're getting to updates. Can you all see updates? Okay, wonderful. So I'm going to start at community level. Community level, as a lot of you all know, I am one of the co-founders of B-Stars, Breastfeeding Sisters that are receiving support. So I just wanted to talk about just community level work. Of course, as you all are very well aware, our moms and families are still very much in need of us in that support. And even amidst the pandemic, our communities of color that were already feeling a certain kind of way are in need of a little more love and care. Before the pandemic, we pride ourselves in having an annual mothers meeting in May. And thank goodness, just the work that we have been putting in the last 5 years of B-Stars has really paid off. There are a lot more home births, a lot more educated families around natural births and breastfeeding. And I just had these as two examples. One mom was so excited that she posted this picture on the operating table, y'all, of her breastfeeding her baby after a surprise C-section. And I was like, oh, that's so cute. But can you please like get off the phone and let them, sew you up? So just, the excitement, the camaraderie. And so thank goodness we had that building before the pandemic. And so it has been so much more important, even more so now. So what we tried to do, we've been virtual this last year. We've been doing B-Stars live meetups. And so how that has been going is we reach out on Facebook and Instagram Live with a topic around breastfeeding. Of course, now, in looking at our glasses half full, we have now a plethora of our friends, our allies across the country that we can tap into electronically to join us on our lives. And so, they're not only just hearing from me and local B-Stars people, but from some people that they wouldn't usually have an opportunity to hear from across the country. What we did in December is we had our first family reunion. So it allowed some of our past moms to join us and just inspire some of our newer moms and their journey. Just we're still trying to figure out innovative ways to be able to really keep our moms and our families engaged. Our baby shower, which is usually in February, but you all know what was going on at the end of February, so we postponed it. We usually have 50 moms. We opened it up to 65 because, we have a lot of pandemic babies being born. So it was like, the need was just there. So we are steadily gathering our things for our baby shower. It will be a hybrid event. They're going to, we're going to send their raffle tickets the day of, and I'm just sharing this with you all. So just, as you all may have ideas of how we're living these days. We're telling you what we're doing. So we're going to send a picture of their raffle ticket the day of the event. They're going to attend the baby shower virtually via Facebook and Instagram Live. Our virtual vendors will be talking about what they're doing around breastfeeding education and support. All of our virtual vendors have to tie in some type of breastfeeding support with their services. They will be raffling off our gifts. And so then I am at my Community Development Corporation office, my other hat I wear. I'm using their office space. So we're going to put their raffle ticket by their gift. And so our baby shower is from 11 to 1. And then from 2 to 4, they will come and pick up their gifts. They'll show us their phone and we will match it with their raffle ticket and take a socially distanced, responsibly spaced picture, hand them their gift, and then they're back at home safely. So that's our plan. So I just wanted to share that. Also, what B-Stars has been doing, we listened to our members, and so there was a need for lactation support. A lot of them were empowered and inspired to help other moms. We've had Rose Transformer trainings with Reaching Our Sisters Everywhere. We hosted last year. In fact, it was the Healthy Children's last CLC training in person on Earth, and we got through with lots of love and Lysol just in case and prayers. But we held that last March. Doesn't that feel like 2 years ago and not just a year ago? But last March, We had a wonderful group join us. We had an 85% passing range, and we are encouraging our others to take it over, and so they can join in as well. It was just super exciting and full of love and great energy and information, entrenched in equity work. So that was definitely appreciated. It is our plan actually to host the Black course. It is actually held by Felicia Floyd, who is here with her beautiful blue and red dress. She is a trainer with Healthy Children. However, it is a additional 45-hour course. It is accredited to be able to be a little bit more entrenched in equity work. So as we roll that out, it'll be later on this year. But just, academically, our moms are inspired by their journeys and want to help others, and they're turning it into a career. So that has been super exciting for us. One of the other things in which you all know us to do is our 3K walk. We are still moving forward with that. In fact, we had to figure out how in the world can we do our 3K walk, in under these conditions. And so a lot of you all are very well aware that with a lot of the social unrest happening last year, just on top of the pandemic, my goodness, quite the year. And so we decided to reach out to our sisters across the country. And what they decided to do is stand in solidarity with us in a national walk. So we took B-Star's national 3K walk nationally, and B-Star's Walk Run in Solidarity under the hashtag of Million Milk March. Isn't that cute? And so it is our plan to continue to do that now that that has been done. And so what it allowed, as Laura was saying, is we did it virtually. People downloaded this app on the phone. This is Charity Footprints. There are other apps out there, but this one was wonderful. And it was made for nonprofits. It even allowed other people who we didn't even know about to be able to donate and support. But they just downloaded the app and they either did their steps. It also included if they were doing exercise at home in place. It was really great. And so what it ended up looking like is this. Isn't this beautiful? We had organizations all the way from Florida. You see us zigzagging across the South and up, and even, I'm sorry, this isn't even the most updated one. We had someone in Boston, Massachusetts, all the way over to Seattle with Cami Goldhammer, who was one of our guests, our speakers at our symposium, and down the coast. And so ultimately the goal is for us to walk across the country. And of course, that last year we were just glad to get started. I think we ended up maybe like almost in Tennessee. But we plan on doing that again this year. Just taking these opportunities to not feel so apart, and using those to make us feel a little bit more together. But in the meantime, sometimes there is just a case that we have to show up with a mom and a baby. We try to do so, of course, socially spaced and responsible. We mask up and we do what we have to do as less hands-on as possible. There are just some of those cases. So that was my update for B-Stars. Be on the lookout for that, you all. I love you all's support and help, and just wanted to give you that. So, which leads me to my second update. As you all know, I am the newly elected chair for the United States Breastfeeding Committee. And what I think is so awesome and wonderful is that we have had this is 2000. Oh, yes, Anna. I see you raising your hand.
No, I'm clapping for you.
Oh. Oh, okay. Thank you. I appreciate you all.
You deserve a round of applause.
Yeah.
So just to say, y'all, we are representing here in Tennessee. We have the chair-elect for the United States Breastfeeding Coalition. And once again, it is with y'all's love and support. It's been a long, crazy journey. But we are affecting national change. And so in 2019, we had our largest delegation from Tennessee. This is some of the members here, 2019. And once again, when we are able to in person, we will do it all over again. And just to say, and I say this in the different hats I'm wearing, as you all find that there's something nationally we need to do, we're already representing Tennessee very well on the map. But please let me know, because I may be able to do a thing or two, or at least, mention it in some good places. So with that being said, I just wanted to let you know we had our membership meeting. The Tennessee Breastfeeding Coalition is a member of the USBC. And so for the membership meeting, we talked to federal partners about their plans for breastfeeding education and support. And so I wanted to share with you all what the top five breastfeeding policy priorities for the 117th congressional session. They are federal funding for breastfeeding, infant and young child feeding in emergencies, access to breastfeeding supports and supplies, paid family and medical leave, and maternal care practices. So that is hot off the press. And so just to say, the work that we are doing here on the ground level is affecting things nationally, and especially with the changing of the guard in the White House, we are in great prayer that we will get some additional support. We know it's a long time in coming, but just know that we are trying our best to support our work here that we're doing on the ground. So I wanted to share that with you all. And their national convening will be totally virtual this year. It'll be online June 9th through the 11th. And so if you have the ability and capacity to sign up, it should be opening up soon. There are going to be a wonderful plethora of speakers and great energy, and it'll be wonderful to continue to represent as we can in Tennessee. So I wanted to share that. And my last few things brings me to Tennessee Breastfeeding Symposium. As you all know, we postponed it from last year with everything going on. It will be this year, June 24th and 25th. It will be broken up into some nice time slots so you don't feel like you're sitting too long for too long. So 24th and 25th, please mark your calendars. We will have Brenda Reyes joining us for our keynote speaker. And she is going to be talking to us about cultural humility and care, overcoming barriers to equity and lactation support. And so we are building our days around great state support. And our host city of Nashville will be giving us some wonderful tidbits of what's going on there, as well, of course, have some state health information as well. So please, it promises to be a wonderful time. What we will do with our, my apologies, I am wrapping up. For those who have not signed in, please, if you would take a moment to sign in, Shakura, we will put the link again in the chat. This not only serves as our sign in, but it also helps us build our state directory, which is one of our initiatives in which we are working on. What we're going to do, instead of having our monthly committee work meeting, which is usually the third Thursday at 10:30 TTT, right, for the Tennessee Breastfeeding Coalition, we are going to use that time to talk about the conference committee work, to just get a few more things together. So if you would love to join us or like to join us, please, once again, you all put in your email addresses. We'll put you in our email blast. I promise not to abuse, and it'll be for right now, just for me. But you will also receive the link to join us if you would like to give some needed input and maybe even a little sweat energy. Not much, but of course, more hands make the work a little lighter. Excuse me. All right. So with that, again, here are our breastfeeding work groups: development and access to lactation support, engage and educate, healthcare provider education, steering committee, and social media, which of course is tied into everything. And so where do you fit in? Please take a couple of moments to see where you might be able to support. We are moving slowly but surely, and with your help, we can even do more. And I know that we are already stretched thin, but I enjoy seeing you all in these places, and I promise we will try our best to make it fun. And so with that, I just wanted to see if there's anything we are doing great on our time. And wrap up, anything needed to be mentioned as we close out, things going on that we need to know?
Yes, Tiana, you want to share the breastfeeding medicine manuscript?
Absolutely. Yeah, you know what? Yeah, thank you, Helen. I did better with you, Helen. I just, there's so much going on. Well, BSTARS is now published, you all. with the help with many on the call today, we have a published abstract in the ABM, Academy of Breastfeeding Medicine. So that happened just in February. So please, it is open access. So please, as we are trying to quote the work that is needed in our fragile populations, you now can say, well, you know, you can quote officially, this is what worked and happened with V-Star. So yes, thank you, Helen. So some wonderful blessings and things that now we can share with others. Once again, we are on the cutting edge here in Tennessee. And with you all's love, help, and support, we will continue to do so. And it will reflect in our family. So that's the ultimate goal. Thank you, Helen. Anything else? All right, well, with that being said, I wanted to end here because usually around our TICQC time is National Oreo Day. National Oreo Day this year is on March 6th. So we are obedient, but I wanted to share that. Jada is usually our girl who keeps us up on that, and it's vegan, and so Shakura can have some. So it's all just a wonderful thing. Plus, you know, hey, who doesn't like milk and cookies, right? All right. So with that all being said, I want to thank you all so much for joining us. And if we can take a group picture really quick, we're going to get off the phone immediately afterward.